Hi, this is Dr. Day, and I wanted to give you a few takeaways for what you can do when you're thinking about any type of insulin resistant, diabetes, other kind of issues and problems. So here we go. Number one, you have to treat the underlying cause and not just the symptoms of whatever your issue and problem is. And so, what you want to think about doing is if you're feeling tired or exhausted or fatigued or brain fog, it could be a thyroid problem, but it could also be another hormonal problem. So, you want to make sure that you get the right test and that you want to look at your estrogen levels, your testosterone, your progesterone. You want to look at all of that female hormonal panel. You want to look at for your thyroid to see if that's the issue. You want to think about your insulin issue, whether it's your blood sugars, making sure you're getting the fasting blood sugars and the fasting insulin test done. And then you also want to think about cortisol or stress. These hormones can cause all of the same symptoms. And when you know which problem is the one that's predominating, you can work with that one. And if you have more than one, you can work with someone to help you to not only feel a little bit better, but to get to your optimal health and wellness because you deserve that. The second thing that you want to think about is that if you have been working on your thyroid, you've been doing all these things and you're not sure exactly what's going on, then I want you to think about that perhaps it could actually be a not just a thyroid problem, but it could be an insulin resistance problem. Many people who are dealing with insulin resistance will feel like they're having sugar cravings, they'll feel tired, they'll have more hot flashes, night sweats, even they also will gain weight. And that people don't talk about insulin resistance. Sometimes they talk about blood sugars, but not insulin resistance problems. So once you know that that's the issue and you start to have your body become more sensitive to insulin, you will not only feel better, but you'll reduce your risk of things like diabetes and heart disease. And I know that's important to you, or you wouldn't be listening to this now. The third thing that I want you to think about is that um, if you are having blood sugar issues and you are pre-diabetic or diabetic, it absolutely can play a role in your thyroid. It's actually been shown that if you have blood sugar issues, it increases the amount of nodules that could show up in your thyroid. So again, if you are dealing with one issue and then you find out that you have another issue, it's important, like insulin resistance, you want to make sure that you're actually treating both of them and that there are plans that you can do that will treat both, that will help you feel better and also improve your overall health. So again, I hope that you appreciate that these things are important for you to understand. They are things that you can overcome in terms of your symptoms and issues. Just knowing the right um, underlying cause of the problem and then getting someone to help you with that will make the biggest difference. So I am very happy to help and support you with any other questions you have about that, but hopefully that will give you some food for thought.